seconded by the Honorable Member from Nkana. The question is that this House urges the government to actualize the provisions of the health services under the National Health Insurance Scheme to the poor and vulnerable. The Honorable Member for Kamfinsa.
Allow me, first of all, Madam Speaker, to thank you most sincerely for allowing me to bring this matter to Parliament, a matter, Madam Speaker, that is very critical to the welfare of the people out there. I am grateful also, Madam Speaker, for authorizing that this matter be debated today, the 14th of June 2023. Madam Speaker, in the year 2018, in this particular Parliament, a very important piece of legislation was passed, and that piece of legislation, Madam Speaker, is the National Health Insurance Act, number 2 of 2018. The following year, 2019, Madam Speaker, a statutory instrument was signed to provide regulations on how national health insurance will be implemented. Madam Speaker, if you go to Section 5 of the National Health Insurance Act, the law empowers an organization called NIMA to manage health insurance. Under Section 63, Madam Speaker, of the law prescribes 4 different categories of persons who are exempted from paying for NIMA. Under Section 16A, Madam Speaker, the first group of people who are exempted are those who are disabled and are not able to work, because we have people that are disabled, Madam Speaker, who are able to work. So the first exemption, Madam Speaker, in the law are those who are disabled and are not able to work. The second exemption in the law, Madam Speaker, are persons that are above the age of 65. The third exemption in the law, Madam Speaker, are persons who are defined to be poor and vulnerable. And I'm aware, Madam Speaker, that people have been asking who is a poor and vulnerable person. Madam Speaker, Section 16 is very instructive, that the Department of the Social Welfare, which is under the Ministry of Community Development, is supposed to establish those who are poor and those who are vulnerable. So Section 16C, Madam Speaker, describes the criteria for determining a person who is poor and who is vulnerable. And I'm very certain, Madam Speaker, that in each of the 156 constituencies in Zambia, we have people that can be established to be poor and vulnerable using the criteria of the Social Welfare Department. Madam Speaker, the last category of people that are exempted from paying for NIMA are those that can be given a prescription by the minister in charge. Simply put, Madam Speaker, Section 16D empowers the minister to determine people that are vulnerable that need to be assisted under the law. Madam Speaker, why have I taken time to indicate or refer to the legislation that governs this particular matter? Madam Speaker, the spirit of the law in 2018 was to identify 2 categories of people. People who are able to earn money, ourselves and many others that have an opportunity to work, and who are able to contribute towards what are called NIMA fees. And then the second category, Madam Speaker, is what I've labored to indicate to this august House. People who can't afford to pay, yet they require health care, yet they need to be attended to at the earliest convenience. Madam Speaker, it will be important before I move to the justification for this motion to inform this august House as well as inform this nation that currently NEMA has only accredited 375 health facilities. Out of the 375 health facilities in Zambia, 150, Madam Speaker, are public health facilities. And these are first-level hospitals that are prescribed according to the regulations. Now, Madam Speaker, if out of 375, we only have 150 public health services, it simply means, Madam Speaker, that if we have a patient today in the rural setup of Zambia, where there is no first-level hospital, those individuals cannot access health facilities under NEMA accreditation. And that is why today, Madam Speaker, when I was coming here trying to put together my thoughts on this particular motion, I wanted, Madam Speaker, each one of us to remember that the spirit of the law was not to cater only for those who are working. The spirit of the law, and in the wisdom of all the members of parliament who were present when the law was passed, was that we are going to have two categories of beneficiaries. Those who are able to pay, Madam Speaker, and those who are not able to pay. And it is very clear, Madam Speaker, from the guidelines on the utilization of funds from NEMA, that as we stand here today, there are people who can't access health facilities because they've not been captured under NEMA. And that is why today, Madam Speaker, I want to appeal to this august House that the spirit of this motion is very clear. This is not about coming up with a new law. We are not asking this august House today, Madam Speaker, to come up with a draft law which we are going to debate, it goes to a committee, and then it comes back here. We are simply saying the law was already structured. I'm simply saying, Madam Speaker, that an institution called NEMA already exists. What is remaining now is for us to actualize the provisions of the law to its full extent. Because if today, Madam Speaker, people who are formally employed are told you have to wait for 5 days for us to get authorization before you are attended to, what about the vulnerable and poor people whose income is not even determined? When will they receive the required health care? So I stand here, Madam Speaker, today to appeal to the conscience of the members of parliament that are gathered here today. We have two responsibilities, Madam Speaker. One to the current generation, and secondly to the future generation. Have we done enough to capture the poor and vulnerable? In as far as NEMA is concerned, the answer is no. Have we provided mechanisms in place to provide access to health care for our people in the rural parts of Zambia, in the urban setups where there are no first-level hospitals within the shortest walking distance? The answer, Madam Speaker, is no. So I stand here, Madam Speaker, given my privileged position to speak to this august House, to appeal that the only responsibility we have today is to agree that we need to actualize the provisions of the law. And in actualizing the provisions of the law, Madam Speaker, government has gone 3 or 4 steps in terms of the commencement of construction of infrastructure. Because to provide health care, you need infrastructure. That is not the discussion for today. The discussion for today, Madam Speaker, is that the poor people in Mulenga compound in Kamfinsa constituency should be able to be captured under the NEMA policy in as far as registration is concerned, in as far as the social welfare department is concerned, so that when they want to seek health care, Madam Speaker, there should be no restriction that prevents them from accessing health care. So I stand here, Madam Speaker, and I want to summarize my submission. Number 1, the National Health Insurance Act is very clear that there shall be 2 types of beneficiaries: those who are able to afford and those who are not able to afford. Number 2, statutory instrument number 69 of 2019 allows for the regulations on how NEMA shall govern its activities. Point number 3, Madam Speaker, the definition of a poor and vulnerable person is prescribed in the law. I'm not asking that we come up with a new definition. I'm simply saying, Madam Speaker, that the law is very clear. Our role today, our legacy as this August House, Madam Speaker, is to ensure that we actualize the provisions of the law to the full extent that the poor and vulnerable will be able to access health care. I thank you, Madam Speaker.